To treat the crisis, basically the only thing they can do is IV fluids to get all the cells moving along the veins, and I'll show you that. Pain medication, and I'm talking about the real pain medication, like the real hard stuff, and antibiotics, and that's about it. Okay, on the left we have a normal red blood cell, and on the right we have a sickled red blood cell. And the name sickle cell anemia comes from the shape that the cells take, and they are called that because they look like sickles. And here we have a picture of a sickle. That is a sickle. It is a sickle. Sickle is a funny word. Okay, here is normal blood flow. You see the red blood cells passing from the arteries on the right, and then they branch off to the veins on the left. No problem here. And then we have the red blood cell magically transforming into a sickled red blood cell. We don't know how it does it. It just does it. It's a wonder. All right, here's where the crisis starts. The red blood cell that turns into a sickle tries to pass through the vein, and it gets stuck because of its shape. And then when the red blood cells behind it try to pass, they get stuck as well, and that's where the pain starts. Crises are different for every sickle celler, even though every sickle cell patient may have the same type of sickle cell. Their crises will differ depending on their chemical makeup, their genetic code, their diet, the exercise level, daily stress, whatever. It depends. It can depend on the time of day. It really just, there is really no defining thing. If somebody has a crisis, somebody would usually say, oh, she wasn't taking care of herself. That's untrue. You can be the healthiest sickle celler, I guess the healthiest person, aside from the fact that you have sickle cell, and still go into a crisis. There's nothing to prevent it. Most of the time, nothing provokes it. It can just happen. Doesn't matter. So you can be taking care of yourself and still go into a crisis. And so crises are different. Pain level is different for everybody. I know it's very, very, very excruciating pain. I mean, there's different levels of excruciatingness. A crisis is very, 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 very painful. Like I said, the pain level depends on the person. It's different for everybody. Usually when a person goes into a crisis, they usually feel the most pain in their joints. But for everybody, this is also varies. Location of pain is different for everybody. Some people can hurt in the stomach. Some people can hurt in the back. Some people can hurt in the legs, arms. Some people can hurt all over their body. Hospital durations are different. Sometimes you can stay in the hospital for a few days and be out. Sometimes it takes a few weeks. Sometimes you can be in there for months. The onset of the crises, some people have crises once a week. Some people have crises once a month. Some people don't have them but once a year. Some people never even have a crisis in their entire life. And then crises can even be sporadic. I mean, like, you can have a crisis once a month, and then you won't have another one for 5 years, and then you'll have one for once a week. I mean, it's just different. There are some things you can do to be a little healthier, like exercise, drinking a lot of fluids, eating the right foods, staying away from the wrong kind of foods, dressing appropriately for the weather. All that kind of stuff will sort of back down a little bit from the crises, but like I said, nothing is guaranteed. There is no way to prevent a crisis. Sickle cellers and having children. For men, it's as easy as impregnating a woman, and for women, it's a little bit more difficult. I'm pretty sure the stress on the mother would make her very, very, very sick. I mean, we're already anemic, and our immune systems are already weak. So I would imagine childbirth would be very, very, very traumatic to the mother. And of course, not only can the child end up having sickle cell disease, but he or she can be pretty sick too. I don't have any children. I have been pregnant twice, and I had 2 miscarriages, and they just summed it up to me having sickle cell, and I just wasn't strong enough to carry them. Hopefully, one day in the future, I can have a healthy child and still be healthy, but for right now, I'm very scared to have a child. I'm scared for the child because I don't want him or her to grow up the way that I grew up, and I'm very scared for me because I don't want to get too sick to take care of the child or pass away giving birth to a child and then leave the child with no mother. TLC, the girl from TLC, T-Boz, she had sickle cell. She had a child. Now, don't quote me on this. I don't know if this is true or fact, but I think I read that when she was pregnant, they did some kind of treatment to where the child would not have the disease, and also so she wouldn't be so sick. I don't know if it's true, like I said, but I would imagine that if there is some kind of treatment like that, it would cost a lot of money, and she has the money to do that. But for us poor folks, we just have to go with faith in God, and if we happen to get pregnant. Just a few personal notes. Yes, I know that sickle cell can be fatal, and I know I'm 30 years old, and I might not live to see 40 or 45, but I don't choose to dwell on it or be scared of it because I know that I've tried my hardest in life, and that's why when something comes along in my life that I'm passionate about, that I put all my effort into it because I don't know how long I'll be able to do it. I don't really worry about dying. The thing I worry about is my little sister and my mother and my grandfather and my family and all people that I love, and how they're going to take it, because I know that I want to be here to see my sister be successful, and I know that I want to do all the things that I need to do in life, whatever my purpose is. I want to make sure that I have done it, whatever God has sent me on this earth to do. I just want to make sure I do it and slip in a little wants along the way, a couple of things that I want to do in life, make sure they're done. Sometimes I get a little sad when I get sick and start to go back in that dark place and like, oh my God, what's going to happen? Like, is this my last time getting sick? But then I'm fine. I don't worry about it too much. For the most part, I just live day by day, every day as it comes. I thank God that I'm alive every day, and I don't like for people to feel sorry for me because I don't feel sorry for myself, and I know people just want to show that they care and they empathize with you, but I just really don't like when people say, oh, bless your heart, or you poor baby, or stuff like that, because it makes me feel like I'm not normal. And on the opposite end of the spectrum of being too generous and too caring, I've had some hurtful things said to me. Like, when I was in the hospital one time, one of the nurses came into my room. She was like, so you have sickle cell, huh? Oh, well, no cure for you, huh? The girl that passed away from sickle cell in her 30s or late 20s that I was talking about earlier, I knew another girl who knew her, and before she passed away, of course, the girl said something of the sort, oh, dying B. And I'm sitting there thinking, like, what kind of person would say that about somebody that's obviously sick? And I'm thinking, well, I wonder what she's saying about me behind my back. I just feel like I always wanted to be normal and do the things that normal people did, because my grandma, God rest her soul, love my life, she always told me to never use my sickness as a crutch. And I have tried my hardest to not do that. So, as always, thanks for watching, and